Welcome to Tech Arena Data Insights. My name's Allyson Klein, and it's another Data Insights episode. So that means I'm here with Jeniece Wnorowski of Solidigm. Jeniece, thanks so much for joining today.
Thank you, Allyson. It's a pleasure to be back.
So, Jeniece, we have a really exciting episode with an actual AI practitioner here with us today. Tell us about the episode and who you brought with you.
Yes, I am very honored to have with us here today Dr. Rohith Vangalla, who is with Optum Healthcare. And it's not too often that we get the opportunity to talk about the advancements in AI, especially when it comes to something like healthcare. So, Rohith, thank you so much for joining today.
Thank you, Jeniece. Thank you, Allyson. Thank you so much for having me.
So, Rohith, this is your second time on Tech Arena. So, first of all, welcome back. And, I think that one of the things that we know is that healthcare is one of the leading areas for AI advancement. There's so many different use cases that healthcare experts are taking a look at in terms of this space. From your perspective, how is the healthcare industry looking at this landscape? And are there areas that you would point out as real near-term opportunities that we should see advancing quickly?
Yeah, first, right. Thank you so much for having me again. It's truly great pleasure to have this conversation. From my perspective, right, AI is fundamentally reshaping the healthcare. So why I say that, right? The biggest shift I see, right, moving from reactive to proactive care, right? What it means, right? So instead of waiting for patient to get sick and admitted into ER, right? By leveraging the AI tools, we can, right, intervene sooner, right? That can dramatically improve the patient outcome. It's really great, right? And then there is the operational side, right? By leveraging the AI, we can automate lot of administrative burden that takes time away from the clinicians, right? So when you go to the hospital, right, you expect to meet with the doctor and expect to have real conversation with him instead of he writing in notes and staring at the screens, right? So that is one more side. And another major impact is accessibility part of it. So AI driven tools, whether it's a virtual assistants or remote diagnostics or remote patient care, are making quality care available for everyone and anywhere in the world. Right. So I really fascinated by the numbers. If I look at the data, right, there are only like 2 to 3 physicians available for 1,000 people, and one physician for every 10,000 people in Africa. This number is really
Wow.
concerning me. So by leveraging this AI tools, we can bring quality of care for everyone and anywhere in the world. So that's a game changer. So in short, right, AI is helping us to build healthcare system that's smarter, more efficient, and truly patient centric.
Amazing. And with that, data management is really central to, all healthcare organizations. How does AI change the industry approaches, managing diverse data stores, and how does this impact things like regulatory controls and privacy?
Janice, this is really important question. So data is backbone of healthcare. Why I say that, right? In the healthcare, right, historically we have this fragmented systems like EHR is one place and imaging data is another, and not to forget, right, the mountains of unstructured nodes, right? So AI is breaking down these silos and pulling all this data together and cleaning up, right, and creating unified patient view. So that's a game changer for clinical decisions and efficiency. But right, here is the thing, just like in the aviation, right? Again, I really like to take the analogy of aviation because I'm a pilot too. So in the aviation, right, where the safety protocols are non-negotiable, in the healthcare, like regulatory compliance, right, security and privacy are also the same. So when I fly, right, every checklist, every redundant system is there to protect lives. Similarly, in the healthcare, right, AI governance need that kind of strict standards. So basically, right, we are talking about having guardrails like federated learning, zero trust framework, bias audits, and explainability tools, right? So basically, explainability tools bring the transparency to the system. So when like a system predicts something, right, we need to know what happened, why it happened, right? Why it give the prediction, right? It's kind of black box in the aviation. So basically, right, AI is making data smarter and more connected, but it's forcing us to rethink like regulatory compliance, security, privacy from the ground up.
What are the biggest infrastructure challenges that you're facing as you take a look at that challenge that you just talked about in terms of scaling AI across this large regulated industry? There's so much affinity between organizations in the healthcare space as well. And when you describe that opportunity to extend the quality of care, it seems like there's some infrastructure that needs to be put in place to do that.
Yeah. So scaling AI in healthcare, right? It's not just about like building a great model or powerful model, right? It's about the right infrastructure to support them. So that's where the real challenges are. So first, as we discussed, right, data interoperability is a huge issue. We are dealing with, right, decades of legacy systems like fragmented EHRs, imaging archives, and, right, lot of unstructured clinical notes. The first step, right, AI needs to clean and connected data. So breaking down these silos is a step one. The second step is that, right, we need to think about compute and storage, right? So training large models on sensitive health data requires massive processing power. But again, right, you cannot dump everything into the public cloud to run the analytics and all that. So you need to worry about, right, HIPAA and, right, all other regulations as well. And you don't forget about the AI governance, right? Every model should have like guardrails, federated learning, like bias audit, explainability tools. So these things are not an optional, it's critical for obtaining the trust. So again, right, the challenge is not just about the technical, it's also about regulations and culturals and, right, all these things.
So Rohit, you got me when you said pilot. I was like, gosh, I can't believe you're a pilot. That's amazing. Not that I want to talk about you being a pilot, but what I do want to talk about are AI pilots. So with that, we're moving from a world where, AI pilots, broad scale deployments, we're moving away from that. But how do you see technology, model advancement, or even human evolution as kind of the central challenge to fully reaping the AI opportunity?
Yeah, Janice, that's a great question. The truth is, right, it's not just about the, you know, like technology or like, it's a people, right? It's a basically both, right? I know. So, in a healthcare terms, right, the technology is moving incredibly fast. We already have AI models that can read mammograms, and in some studies, right, match or even outperform radiologists to able to detect, right, anomalies in the breast cancer. you know it- and another great thing, right, like Google's met Palma 2, right, it basically answers the questions almost like, near expert accuracy. So we have that models are still available, but the real challenge, right, human adaptation, right, so when we introduce something, right, hospitals had to redesign their workflows. They need to retrain their staff and make sure it fits with the privacy rules. It wasn't just like, hey, I have developed something, right, I have some machine, right, I will just embed it into the system, right? It's not kind of plug and play. It require people to adapt it. So again, right, it's isn't just like technology revolution, it's a human one too. the factors like, we need to have doctors, nurses, clinicians, and organizations, right, work collaboratively to get the full impact in the healthcare.
Now, scalability is really critical as well. And when you're talking, it really occurs to me that this is going to be something that needs to be navigated carefully as we look at broad proliferation of AI. What strategies are being used to ensure AI solutions can grow from that pilot phase that Jeniece mentioned to enterprise-wide deployment? And what are you doing in your own practice to think about scalability?
Yeah. So whenever I work on any projects, right, whenever I'm architecting it or whenever I'm interacting with someone, right, I always give three tools, right? First, we need to standardize, then we need to modularize and automate, right? So when it comes to the scalability, right, scalability is where a lot of AI projects in healthcare either succeed or fail. Why I say that, right? Moving from pilot to enterprise-wide deployments take more than just a good model. It requires a strategy, right? So first, standardization. So basically, the pilots, right, like POCs are like, any spikes, right? We run on isolated data sets. So we'll take like, some bunch of data to run like through like, proof of concept. But at a scale, you need to have consistent data pipelines and, right, the data interoperability. And like, we need to consider like, how we have the EHRs, imaging data and unstructured node, right? So we need to have this data interoperability across the system, and we need to have like strong data governance. So without these foundations, right, scalability is almost impossible. Second, we need to adapt for like modular architecture. So we need to have API driven and microservice based designs. So like, whenever the systems will evolve, right? So AI components can plug into existing workflows without, right, rewriting entire code base or like, anything. So that flexibility is really critical. So we need to make sure to have modularity in our architecture, and don't forget about the automation, right? So automation will basically, we need to put continuous monitoring and retraining and compliance check that needs to be baked into the automation. So, humans sometimes forget, but once these systems are in place, so, you don't have to manually manage like, hundreds of models across an enterprise. So this automation can help to ensure that, right, all things run smoothly. So at the end, right, you should have the standardization in the data. You should have modularization architecture and automation, to make sure the system run properly.
That's
Awesome.
fascinating. I like how you, I like how you simplified that. I don't think anyone has simplified it in that way. But in your opinion, if you have all those things kind of working together, where do you really see, AI advancing over the next year?
Yeah. So till today and like, coming in the near future, I really see that, right, the voice AI and ambiguous listening will transform the clinical documentation. So these tools use natural language processing to capture patient provider conversation and auto generate structured notes to reduce the like, provider burnout, and like, it dramatically improves the data quality. So we don't have to worry about, right, pulling all this unstructured note and like, fine tune it and right, put it into the system, right? So we can leverage these tools to have generate the quality of data. Second, I still, in our organization, and we are, I know a lot of other organizations also doing that, AI-powered chatbots in the healthcare will move from like, pilots to clinically approved tools. So this is not just only like, assess the symptoms and provide the guidance, right? But these tools can help you to like schedule an appointment, like, it will remind you, and like, it can guide tailor, guidance on like when you refill the prescription and understand your needs instantly, right? When you are coming to the platform, then, right, will basically like, know why you came to the platform in this time period, right? So we can cater personalized sessions to you and recommendations. So we'll continue to see the advancements in like AI models with agentic AI capabilities. So again, right? So we expect to see like FDA approved clinical AI machines also. So yeah, I mean, every sector is moving ahead, but mostly like these things are will happen in very near future.
Now, one thing that I thought about, and you talked about, regulators, and, there's obviously a lot of demand in healthcare providers, but as you implement AI, you're really delivering core capabilities in a completely different way. How do you see conversations between healthcare providers, technology partners, and regulators shaping the future of AI for healthcare?
Yeah. So the future of AI in healthcare, right? It's really depends on strong collaboration between healthcare providers, technology partners, and regulators. Each one has their unique position and role to play here, right? Healthcare providers contribute clinical expertise and the real world data, right? So technology partners bring innovation, building AI tools that can basically like diagnose, predict, and personalize the care. And regulators, right? So they will ensure these tools safe, ethical, and effective. A great example, right? I can recall, right? You know, so the collaboration between like Google Health and Mayo Clinic, right, where AI models are being developed for early detection of cardiovascular conditions using like wearables and imaging data. So the key here is that clinicians are involved from start, ensuring that right these models are clinically relevant and ethically sound. So ultimately, right, we need to earn the trust, right? When these three groups work together, then they can earn the patient and right consumer trust. So when these groups work together from the start, like sharing the data standards and building explainability tools and aligning compliance, we move faster and build the trust. So that is the key here.
Amazing. I think our listeners are going to want to know where they can learn more as well. Can you, and it's been a fascinating conversation, can you share with our audience today where else they can go to learn more?
Yeah, so I would recommend like going with like trusted source like FDA is like AI in healthcare guidelines, and like go over like reading like peer reviewed scholarly articles, right? And also attending the conferences and like reading the blogs, right, these will give you right information about what's happening around them, and like what are the technology advancements are happening, how they can adapt it to like their daily lives, right? So yeah.
Awesome. Well, Rohit, thank you so much for being on. I learn something new every time I talk to you. It's fantastic to learn a little bit more about the healthcare arena and AI, and I can't wait to see the advancement over the next year. And with that, we're going to wrap another episode of Data Insights. Jeniece, thanks so much. It's been lovely to have this conversation and share it with you. I can't wait for the next one.
Thank you, Allyson. Thank you, Rohith.
Thank you, Jeniece. Thank you.